And then, as I said, Sean Klimick at the Census Bureau, who's going to talk with us for a little bit about his view on how research in RDCs is growing over time and how the importance of that research is changing as the fields are affected by the kind of work that's done in the RDC environment. Sean?
So that's what Mark thinks I'm going to talk about. Demography, health, and planning are really not my areas of expertise. So I've been in the current job that I'm in for about a month. So part of the reason why I think it's a good idea for me to be here is to kind of better learn about the different populations that I'm sort of less familiar with, and how all of you will use the research data centers kind of in these areas. The purpose of the RDCs is really to, at the same time, increase access, but still maintain the confidentiality of the data. The Census Bureau, in many cases, is now acting as a steward of other agencies' data as well. So one of the ways that I see the research data centers growing is, purely in the numbers of research data centers, as the University of Washington is building a research data center. It will be open this year, just like the Texas Research Data Center. Branches are opening in Southern California. There's been a new effort that began in 2012 to start opening survey-sponsored data centers. So the National Science Foundation is the first agency to get one, statistical agency to get one. The requirement is really that the statistical agency is defined by the Office of Management and Budget, sponsors a survey with the Census Bureau, and these agencies, we make them, they're all located in Washington, so they come to the Census Bureau to access data, just like you'll come to the Research Data Center to access data. Making all their employees travel across town is costly. And at the same time, I think we want to build better relationships between the Census Bureau and the survey sponsors. They are the data experts, right? The reason why we're collecting the data is because, they have an interest, or they're mandated to sort of measure these parts of the economy or the population, and the Census Bureau has the frame in order to collect that data. So it's partly a Census Bureau data set, but partly a survey sponsor data set. So I think one thing that will do over the long run, at least my hope, is that it's going to build better relationships with the survey sponsors, and hopefully allow, or encourage those agencies to start hosting additional data in the research data centers. So they, in addition to sponsoring Census Bureau surveys, have a lot of other data that they collect. And I think to the extent that data collected by NSF or the National Center for Education Statistics, the more data that can be hosted in the research data centers, kind of the bigger pool of researchers can grow, and the more sort of diverse the researcher population can become. In terms of these areas, I will talk a little bit about one related research paper I have using economic data in the health area. Is I'm an IO economist by trade, so I'm interested in market structure, firm performance, and so we had a paper that focused on, and a lot of my research has a focus on very localized markets, so exploiting, within a cross-section, geographic variation. So we had a paper that looked at the structure in local markets at the place level of dentists, the dentist office, the dentist industry, dental industry, and chiropractors, kind of two healthcare providers, although I don't know if you count chiropractors as healthcare providers. That's probably a question that's open to debate. So And, so we use the business data from the Census of Services to do that. And, I think that the Census of Manufacturers and the manufacturing data, where we collect very detailed information on inputs and outputs, is where a lot of the research has been done. And even though there's lots of researchers in the RDCs, I think these service sectors, retail, wholesale, there are lots of sectors of the economy where there's been a lot less work being done. So one of the things that we were able to do, because we had very detailed information on geography, was to only focus on small markets, place level between 5,000 and 50,000 people. We also picked isolated markets because we didn't want markets that were close to one another in case you were willing to travel, a distance to go see a competitor in the market or in another market. So, we were able to exploit the detailed establishment level data, the detailed geography that's available in the census. And then we were able to match in data on underserved markets where there's, subsidy, the government provides subsidies to provide dental care. And then, we ran a structural model, and then we were able to look at how big would the subsidy have to be to get a certain number of dentists per 1,000 in the population, right? So that's one example, I think, where, that wasn't even using the health data, just using the business data and the establishments, dentists, and the detailed information there. So that's my one sort of health example. So I think it's probably a better use of my time to kind of listen to the questions that you have, but I think that the research possibilities will be great and hopefully ever improving. So,
thanks, Sean. A couple of things just to add. The projects that go through the Center for Economic Studies, the projects that use census data, will go through a particular review process. Projects that go through, that use only the health data, which are provided by the National Center for Health Statistics, they have a different review process. It is described as an easier process, less demanding in some of its requirements. So that will come up, I think, in our discussion here. We want to know the difference between those two, and when you need to do the more involved process at the census, which includes something called a census benefit statement. We'll wind up discussing what that is and what's involved. If you're a health researcher and you're doing only an analysis involving the health data, you may be able to sidestep that, which will be a good thing, narrowly speaking. Trends I've heard are that, say 2000 to 2005, probably 70% of all projects in RDCs were in economics and business. And that in the last 5 years, the growth of health-related research has really been quite dramatic, and that number is shifting. So,
I think the numbers just for the economic projects is there's about 600 researchers in the RDCs just using the census data, and about 180 projects.
A little bit later, I'll cue you up now, but in your handout you'll see there's a one-page description of a funding program, a small grant program to help with proposal development. The reason why you might be interested in that, I think, will become clear as we talk about some of the things that you need to do in preparing a successful proposal. So just keep that in mind, and at a later point, I'll pull it up and say a little bit more about it. The deadline for the application is a month away, and it's not a very demanding proposal, but it requires some thought. And today, hopefully, will stimulate some of the thinking here.